reopening of our schools and learning institutions. The government, through the Ministry of Health, has also come up with a toll-free line to report cases of COVID-19 infection. Number is 719. A gender-based violence line 1195, and a Red Cross emergency line 11. Similarly, Ministry of has also issued guidelines on home-based care and the above measures reaffirm that Kenya is committed of the African rights and welfare to promote and protect the rights and welfare of our children. With this few remarks, I wish to thank you all for giving us time to make our presentation, and now invite the committee of experts to guide us on the next level of engagement. I thank you and God bless you all.
Merci beaucoup, Monsieur le chef de délégation, pour cette brève présentation. Ce qui va suivre, c'est nous aurons, si vous voulez, des sessions pour cette occasion. Dans un premier temps, nous allons pouvoir soulever nos commentaires, nos questions de clarification.
First, we're going to make our
Premier groupement de questions. Nous allons commencer par les mesures générales de mise en œuvre. Deuxièmement, la définition de l'enfant.
Sorry, sir.
Troisièmement, les principes généraux de la charte, comme la non-discrimination, l'intérêt supérieur de l'enfant, le droit à la vie, survie et développement, la participation de l'enfant.
Sorry, sir. Once, let me interrupt you.
Droit civil.
Sorry. Please, Mr. Shaib, switch to French. Switch to English, please. Switch to English. Sorry. Okay, continue, sir. Sorry.
Okay,
sorry.
Non, si vous voulez, je peux répéter la façon dont nous allons procéder. En premier lieu, nous allons passer aux mesures générales de mise en œuvre. Deuxièmement, la définition de la...
And we're talking about the general principle of the charter, the principle of discrimination, the right for life and for development, for the civil rights and liberties. They're under the first series of questions. The second round of questions, we're going to talk about the family environment and about the health services, leisure, cultural activities, and also challenges in terms of protection. And after first, the first round of questions, we're going to give you 20 minutes in order to consult amongst yourselves, then come back to give us answers, and then move to the second round of questions. We're going to start with our rapporteurs, and Honorable Aver first, and then Honorable Nani Kinkwe, and then we give the floor to other members of the committee. We're going to get Honorable Aver for her comments. The four groups of issues or questions to Honorable Aver. Thank you. Honorable Aver, can you hear me?
The robust policy and legal framework you have on ground, and all the legislative initiatives and policies taken to.
Honorable Aver, on ne vous entend pas très bien.
Sorry, Mr. Chair, I don't seem to have interpretation into English. But still, I will go to first question, that there appear to be a multiplicity of mechanisms and policy measures responsible for children's rights. So maybe you can enlighten the committee as to which exactly is the coordinating body. It may appear to be the National Council on Children's Services, or maybe we'll seek clarification about that in view of the budgetary allocation. Because there is a noticeable progressive increase in budget allocation to child-related bodies. It ranks amongst the last, compared with the Child Welfare Society. And what is the mandate of the Child Welfare Society? And I want to know a little bit of its overlapping, if it does not overlap with the duties of the National Council for Children's Services. Also, you did indicate that the Child Justice Bill was drafted in 2020 to raise the minimum age of criminal responsibility in line with the recommendation of the committee in its concluding observations. And so what is the status of this bill? You did indicate that it is with the Office of the Attorney General. It has been with the Office of the Attorney General.
Hello? Hello? Chairman.
Yes, please.
Can I respond or we call the questions?
Non, peut-être qu'il a un problème de réseau, sinon il va y avoir toute une série de questions et vous allez répondre juste par après.
Monsieur le Président, elle a un problème d'Internet. Merci de donner la parole aux autres membres du comité.
Honorable Naniki, en attendant que la connexion revienne pour Honorable Aver. Honorable Aver, vous pouvez continuer ou bien?
Okay, thank you, Mr. Chair. I think that's a connection. So, okay, on non-discrimination, what progress has been made towards their social integration? If you recall, in line with the committee's decision in 2011, as well as the interface with the committee in 2017 in Lesotho, as cited by you. The committee was expecting a progress report on this issue in terms of what measurable progress has been made in the areas of education and general social integration of the Nubian children. Granted that even the Basic Education Act, it makes education accessible to all marginalized groups. So we want to know, the committee may wish to note what progress has been made towards enrollment of children of Nubian descent and towards their overall, their general integration into the society. You also have an accession under non-discrimination. You have an accession which says that children with disabilities access buildings through assistive devices like ramps, and the visually impaired have been provided with the Braille. I'm afraid this accession sounds more like an aspiration. It sounds more like an ideal. So maybe you may need to enlighten the committee in practical terms how much of this has been achieved, how much children have been able to access public buildings and to access assistive devices, especially in the area of education, and that's which settings, give us an idea of the settings. If you have initiatives, you have a response plan that you are implementing in this area, how decentralized is it? Because much of the time we have these facilities only in the urban centers. And so how much is this decentralized in such a way that children living in the communities also have access and assistance, children living with disabilities in the communities? And so what about, how have you also dealt with the issue of discrimination, stigmatization at that level, especially at the community levels, in the issue of, in the area of non-discrimination, especially against children living with disabilities? Okay, and in the area of the torture and abuse of children, you have the Prevention of Torture Act of 2012 to stem the torture and abuse. And you have also made progress, have a progress report on the determining the forms of disciplines this being developed. It's okay for you to develop guidelines and programs. It is very commendable indeed, but I think the committee would like to have an impression of how this has translated positively towards, the welfare of children. Have
Apparemment, sur les objets, on peut inviter Honorable Naniki.
Thank you, Chair. Can you hear me? Can you see me? I see R on my screen. Can you hear me?
Yes, it's okay. It's okay.
Oh, thank you ever so much, Chair. Let me recognize the leader of the delegation of Kenya, His Excellency, Mr. Simon Chilugi, and your delegation. Let me also thank the leader of the delegation for his introductory remarks, in which he actually just took us through their current responses to the pandemic. In saying so, also congratulate Kenya for submitting their second and third periodic report. Maybe to start with, I would like to reiterate what my colleague has said. Is the Children's Bill not yet enacted?
Un instant, Honorable Naniki, apparemment, il n'y a pas d'interprétation en français. Donc, si vous pourriez commencer dès le départ. Il y avait un problème technique d'interprétation. Honorable Naniki, if you can start.
Thank you very much. Is there interpretation now? Can I go ahead?
C'est bon. Oui, c'est bon, c'est bon. It's okay.
Thank you ever so much. I started by recognizing the head of the delegation of Kenya and his delegation and welcoming them to our session. And I, in particular, would like to thank the head of the delegation, Mr. Simon Chilugui, for actually, in his introductory remarks, taking us through the COVID-19 responses that Kenya has put up. Thank you very much for the update, Your Excellency. I would now also like to congratulate Kenya for the second and third periodic report. And in going forward, I'd like to start by reiterating what my colleague, Honorable Ogava, has asked. The issue of the draft Children's Bill of 2019. It was initially 2017, is 2019. When should we expect this bill to be enacted into law? Because you have made so much reference of it, but it has not yet taken effect. Now coming to the legal frameworks that you have put in place, there are several of them. The National Plan of Action, the guidelines on birth registration of orphans and vulnerable children, the National Plan of Action on combating human trafficking, the National Plan of Action on commercial sex exploitation, and the PSS guidelines. This is quite a commendable effort to putting measures in place. My question is, what has been the effect of all these policies and programs, and what has Kenya done to the lessons learned on the effective implementation of all the listed guidelines? If they have documented them, can they, after this session, probably share with us the experiences of implementing all these documents and policies and National Plan of Actions that I have just listed? You have introduced a new legislation called Victim Protection Act of 2014. I would like to find out from you what makes up the implementation structures, what should the implementation structures of this act, what is the background training of all the actors in it who are implementing it, and also to find out from you who provides oversight to ensure that victims are not retraced and that victims indeed benefit from the VPA Act. Are there any legal structures for recourse should the VPA fail to meet the needs of the child victim? Coming to the legislation on Protection Against Domestic Violence Act of 2015, I recognize that you have indicated that the GBV has become an issue during COVID-19. Now, what I want to find out from you is, have you put processes in place to scale up prosecution of perpetrators? And you were talking about lockdown and that maybe they maybe have been slowed down of certain processes, but the need to protect victims of gender-based violence and children requires that the courts and the DPP should act promptly and deliver justice for the victims. I recognize that under justice, children actually commemorate Day of the African Child under the theme. And then that you have also indicated that you set up a special task force called the National Council on Administration of Child Justice for Child Matters. How far is delivery? What have they done? Are they delivering according to the terms of reference? And have you really effectively, can you illustrate that you have effectively leveraged on the theme of the Day of the African Child to give meaning to this cancer? I have a question on female genital mutilation and recognize with appreciation that you have set up an anti-female genital mutilation board. What are its achievements, this board? Can you hear me? I see the Can I go on, Chairman? Chair, can I go proceed?
Oui, vous pouvez continuer. Vous pouvez continuer.
Hello, Chair.
Yes, proceed.
Yes, go.
Thank you. Thank you. On FGM, I want to find out from you, what has been the buy-in on anti-FGM activities, with particular reference to buy-in from traditionalists, the traditional leaders? Have they really bought in, particularly in the remote rural areas where we need to have the traditional leaders and the faith-based leaders actually buying into this campaign? Lastly, my question will be on protection against child abuse and torture. I have stated that you have to come up with prevention, torture, and what I would like to find out, because the report is very silent on what happened after the promulgation of the Act. What are the measures in place to enforce this Act? You know, there could be an Act which is there, but we need to have measures in place to give meaning and effect to the Act. Are there any laid out standards and norms abolishing child abuse and torture at family level in care facilities that I see you are closing down now because of COVID-19, and any other holding places for children? What are the standards and norms for ensuring that there's no child abuse and torture? Finally, I would also like to find out if Kenya has any documentation regarding action for perpetrators of child abuse and torture at schools and at our care facilities, or to find out even whether there has been documented action taken against any law enforcement agencies which may be found to be violating legislation, because the legislation has been in place for the last 3 years, and what modalities to put in place to get the family to embrace the prohibition of physical abuse and torture at family level. Finally, how have you engaged traditional leaders and religious leaders to advocate for protection of all forms of physical, emotional, and sexual abuse of children? Honorable Chair, this was my first set of questions. Let me thank all you for giving me the chance to ask my questions. Thank you.
Merci beaucoup, honorable Naniki. Est-ce qu'on peut vérifier s'il y a puis avoir la connexion de passer aux autres membres du comité? Okay. Ave? Apparemment, non. Donc, je donne la parole aux autres membres du comité.
This guy is speaking. Yeah. Nasikia kitu. Though they are not.
Les autres membres du comité. Honorable Maria. Yes, Honorable Maria. Yes, Maria Mapane.
Yes. Mr. Chairman, I keep on losing connectivity, and I wanted to find out if we're asking according to clusters, or I could just go ahead with what I want to ask before I come in.
Oui, les questions sont posées en fonction des thématiques. Honorable Bekrin.
Yes. Mr. Chairman, I wanted to ask questions because I couldn't connect immediately, so I don't know whether they should come towards the end.
Pouvez y aller.
Yes. All right. Yes, I would like to thank you for this opportunity and to welcome the government of Kenya, led by His Excellency Mr. Chelugui, on the presentation of their subsequent state reports. And let me state that as a special rapporteur on children's parental care, I'm happy to notice that there's actually some statistics given on what the situation is in Kenya. Having said that, I will really pack my questions as to how Kenya has responded to the plight of children in the advent of COVID. And I'll start by asking, how has it impacted on children and the ability of the government to ensure that children's rights are respected, especially in the areas of health, in terms of access to in terms of access to medical care and treatment for non-childhood diseases. My second question is how children out of school are being treated, because there are reports that there are a number of girls in Kenya who have become pregnant during this period. And beyond this, the question would be how would they be provided for, because these without parental care children who have unfortunately maybe been lost in the gaps or cracks. The other question that I have is on how children with special needs and those without parental care are being, what sort of measures are there that have been, rather, what measures have been put in place to guarantee the rights of these children, because they are special in the sense that they do not have parental care, and also they are special because since they have special needs, they might really be ignored, as opposed to those children who are not with different, not differently aided in society. And also I'd like to maybe finally find out how the COVID reports, or rather COVID information on COVID is disseminated. I follow the news quite closely on the COVID situation, and also the reports, if at all they are available. I'd like to find out if disaggregated to show the impact of COVID and the number of cases or the number of children who are affected by COVID, and of reporting. Do you follow? What do you report on? Do you just report on statistics, or there's something more that you report on how children are affected by COVID? I'll end there. Thank you.
Merci beaucoup, honorable Mapani. Je vois honorable Aboubekri.
Merci, Monsieur le Président. Merci, Monsieur le Président. Je suivais avec beaucoup d'intérêt le rapport présenté par la délégation kenyane.
The Kenyan delegation, my questions will be first on children who have problems with who are born with disabilities, and children who didn't have the chance of taking care of birth. And it seems that they have introduced a certain number of articles in the Kenyan Constitution. These articles in line with the principle of the Charter on the welfare of health. Would like also to to some more explanation on issues related to children living with disabilities. My last question is about children with specific needs and how they are affected by this COVID-19 because they need a very special and how these children are taken care of. The Kenyan government has taken initial measures as concerns these children living with disabilities in the context of COVID-19. I thank you, Mr. Chairman. Thank you very much. Honorable Abdul Karim. Marie Boko.
Je voudrais également joindre ma voix à celle des collègues pour remercier et féliciter la délégation kenyane.
To thank the Kenyan delegation for this excellent presentation. I have two concerns on the report. The first one is about the FGM. The African Union has launched a campaign on FGM in order to come down to zero mutilation in Africa. While we know that this practice is going on, and Kenya has opted for medicalization, which goes against this initiative of the AU. I would like to know what are the measures, that is administrative or health measures, that have been taken in order to remedy to medicalization, and I know to put an end to this practice in Kenya. The second question, or second concern, has with education during this period of COVID-19. We would like to know whether there is a distance learning or distance teaching that has been set up by the Kenya, and is the rate or percentage of children that are involved in this distance learning and teaching in Kenya, and what have been the effect of this online learning. Thank you very much. Thank you, Honorable Bokom. Any other member from the committee who wants to take the floor? I see Honorable Ermin Kombo. Thank you, Mr. Chairman.
The member of the delegation, as well as all the participants to the meeting. I'd like to point out to the COVID-19 responses, and as the head of delegation pointed it out. And on that, I want to be specific on just one case which has been brought to our attention, the case of the 13-year-old boy who was killed within the context of enforcing the curfew. So I'd like the head of delegation to give us information on the outcome of investigation, which was said to be open on that case. Thank you. Concerning the child named Yasusen Moyo. Thank you.
Merci beaucoup, honorable Hermine. Quelqu'un d'autre membre du comité voudrait bien prendre la parole? Voilà, monsieur le secrétaire exécutif, secrétaire de cabinet au ministère du Travail et de la Protection sociale, les questions de demandes de clarification qui vous ont soumises. Il est vrai, il y a des fois on trouve des questions qui sont presque mélangées, qui devraient peut-être apparaître dans la première de questions. On va vous donner 15 minutes pour pouvoir vous concerter et par après, on pourra revenir pour...
And give answers, and also hear the second round of questions. So it's 4:01 Addis Ababa time, Nairobi.
Thank you.
So going to resume in 15 minutes at 1:20 Nairobi time. Thank you.
Right now it's 1 o'clock. In 1 o'clock, 5 minutes.
So you can use the link that is provided by the committee in case you are not all together.
Yeah, we need a break.
Consult. Yeah, break of 15 minutes. 15 minutes. We're coming back at 1:20. Yeah, just minutes in order to consult among themselves and come back to us.
Okay, did you provide for breakaway meeting rooms? Hello, Chairman.
Could you explain what's?
I'm asking, do you have breakaway rooms in this video conference where we can assemble the team, the Kenyan delegation, because we are not sitting in the same office. We are scattered.
Yeah, this is what we're going to explain to you, sir.
Okay. Thank you. Thank you. Thank you. Okay. Give us 20 minutes, please. Give us 20 minutes. So, thank you. So, we can.
No. Mr. Eviano. Mr. Eviano.
Yes, please. I have sent. Good afternoon. Sorry, I had technical problems.
No problem. Now I am. Now you are assigned. Please help Mr. Shaib. He's almost dying.
Yeah, I have sent it to him to confirm, but he hasn't confirmed.
No, I'm
still immediately you told me, I sent him message to confirm, but
thank you very much.
He has not confirmed that I should take over.
Yeah. Anyways, Mr. Shaib. Yeah, he's saying he sent you a message, but I think you have not seen it.
No.
Anyways,
I didn't get
all right,
any
thank
message
you.
from him. No.
Maybe. Thank you very much.
It's all right. Anyways,
anyway, I sent him some
when
messages, but there was
they come
no
back,
action.
you just continued. You
Yes.
said?
Yes.
Mr. Eviano, he's talking to you.
Colleagues, you are live. Can you mute your conversations for a while? We are listening to.
Yeah. Because we are organizing with interpreters. It's on purpose. It's not by mistake. Apologies. Yeah.
Thank you. Sorry about that.
Okay. Yeah. Just continue on chatting. Yeah, just chat on that one. Okay.
Excellencies, delegation of Kenya, can you please connect on the link that we have sent you by email, which will ask you, of course, to leave from this room, and then we will reconnect with discussions. So we're waiting for you in the other meeting room. Please go to the email where we have sent the link on. Thank you.
Has the breakaway meeting started? Hello?
Chairman, the breakaway link has not been received. The breakaway link has not been sent. We have not received.
Philippe, est-ce que Philippe?
Yes, Chair, it's Ayali here. Mr. Simon and colleagues, we were told by our colleagues from AIS that it's not possible to create a breakout session on this particular webinar Zoom website. So a link. So what we have done is we have sent you a link by email copying to, NCCS Council and Sheikh, I think, the email that we've been communicating to, we have sent you a link where you can actually join. So we're waiting for you in that room, in that meeting room.
Thank you very much.
Okay. Merci.
What we need is their email addresses. That's what we should have done.
Yeah.
And send them directly. If she can give us.
Yes, Catherine.
In 100 meters, turn left onto Hilda Street and turn left.
It's inside.
I can't even get.
Okay. Okay. But directorship, okay. Then I think we'll still refer that to you. Okay.
Trabun.
Monsieur le Président, honorable membre du comité, honorable membre de la délégation du Kenya, nous les avons informés de se joindre à cette réunion pour qu'on puisse continuer l'examen du rapport du Kenya. Donc, ils vont se...
Ok, s'ils sont prêts. On ne les voit pas.
Hello?
Monsieur le ministre, on vous voit maintenant.
Hello?
Yes, please.
Thank you. Thank you. So can I go? Can I
Yes,
respond?
go.
Thank you. Thank you, Chair.
Oui,
Joseph.
oui, monsieur le ministre.
Chairman, I must admit that you have actually shocked us with the number of questions you have sent us and also the level of understanding by the team. And I can say truly, you are a team of experts. So we have attempted to discuss in our breakaway meetings, and we have tried to respond and answer the questions to the best of our knowledge. Chair, since I'm accompanied by a team of experts who are touching on the questions, specific questions, I would kindly request you to allow the team to respond in their respective dockets. But let me recap the questions. The multiplicity of policies and organizations, Child Welfare Society and NCCS. I will ask the acting director, the National Council of Children Services, to respond.
Jen may be knowing.
Sylvester, you mute. Sylvester, can you mute? A child justice bill, and I would ask Masese to respond to that. The Nubian children, their admission, their rights, Director of Children Services will answer. The children's bill, currently the status and why it has not been enacted. I think we have a representative from the Attorney General's office. The effects of policies and programs, I will ask Engineer Sangani to respond. Victim Protection Act, I'll ask Masese. Implementation of Witness Protection Agency, that is in charge of implementation works within the justice system. And then I will also ask on Domestic Violence Act, I'll ask the police service to respond. The anti-FGM board, I'll ask the DCS and the police to respond, and they will give us the achievements, the buy-in from the community, traditional leaders and faith-based leaders. Medicalization of FGM, not government policy. FGM is that I will ask Laura to explain. The torture of children. All this I will ask IPOA and abolishing of child abuse. On the issue of COVID and response, I will ask Laura, DCS and acting CEO of Child Services to respond, and the Minister of Health, and including the disaggregation. And we've been doing very well as a government in updating the country and the world on the status and statistics and also the information. And we've been monitoring the trend. And I'm happy to report that currently in Kenya, we are seeing the trend, the curve is flattening or is coming down, which is good news. Then number 11 is child pregnancies. And I'll ask, especially currently when schools are closed, I'll ask the Director of Children Services to respond on that. Education, we have an officer in our team, that is Mr. Mulembe, on a number of children accessing online learning. Then the boy was killed during COVID by police, or he said by police. I have IPOA in the room, So they'll also be able to respond. The child marriages, Director of Children Services, and then assistive devices for education for children, and then care reforms, children without parents and street families. I will be able to ask the director to respond. So, Chairman, I would like to ask my team. Hello.
Oui, monsieur le ministre.
Yes.
Hello? Hello? Hello?
Oui, je vous entends.
Waziri, we are following you.
Monsieur le chef de délégation, le micro n'est pas allumé. If you can switch on your mic. Okay.
Yes, yes. Can I ask the members of my delegation to kindly, quickly, in the next 10 minutes, to respond individually based on your respective docket? Kindly come on.
Thank you, Chair. This is Noah Sanganyi.
Merci.
This is Noah Sanganyi, Director, Children's Services. I've been given quite a number of issues to raise, to respond to, and
go on, Sanganyi.
Yes, I will now go straight to respond to the various areas that our CS has given me. One of it is the Nubian children, how they are accessing education. Chair, I represented the government of Kenya in Lesotho 2017 when this issue was very hot, and indeed it was solved thereafter. That the issue of birth certificates was a big issue. It was hindering them to go to school, and I can confirm that that has been resolved, and the children do not have any issue attending their schools. They have been integrated back to the community very well. I have a children officer in the area of Kibera where they work very closely with the community leaders from the Nubian community. That is one area. The other second area was on the effects of policies and how integrated these policies, the various policies and legislations. We have a program-based program in the government where once a policy or guideline has been launched, then we include it in the annual work plan of the various ministries. And I can confirm that the various guidelines on children have been translated into the annual work plan of the Department of Children's Services, especially this financial year. What we are implementing is what has been the various policies which have been passed by government. On the issue of FGM, I want to confirm that the Department of Children's Services, together with other stakeholders, both at the county and national level, are working closely to disseminate the various issues relating to the harmful cultural practice of FGM. And at county level, I've had my officers go into the local vernacular stations to talk about the effects of FGM. They work closely with the national government administrators, that is the county commissioners and deputy county commissioners, up to the level of the chiefs and assistant chiefs. We also do a lot of rescue. Of late, we have been doing a lot of rescue of those children who have been affected by FGM into the various rescue centers, and where we provide counseling for them. The other area which I've been tasked to comment about is on teenage pregnancy. It has been a national issue of late. His Excellency the President directed the National Council for National Crime Research Center, of which I'm a board member, to give an advisory on teenage pregnancies and domestic violence, and also for children, and also violations against children's rights. This advisory has been made. It's now in the rightful hands. So I'm not able to talk about it because the president has this information and all the other members of the office of the president. All the issue, I can confirm that it was properly done and scientifically done to give the country some guidance. On the other area which I've been given to talk about is on COVID response to children, both those in the institutions and those in the community. As a Ministry of Labor and Social Protection, specifically the State Departments for Social Protection, we brought together all the stakeholders dealing with children, and we had to see how best can we intervene on behalf of children. And based on this, our principal secretary issued a circular to all the stakeholders to look at the issues of children, both especially in the institutions. This is where we encourage the children to go into their communities, together, assisted by our children officers in all the 47 counties, and they are back in the community. We are doing supervision to see that they are okay. There are those who are outside the institutions, that is the statutory institutions, and also charitable children institutions. We are also working together with the other officials of government. The last part is on child marriage. This, I've already talked about it earlier on, that the county children officers and sub-county children officers in the whole country, they are working together with other stakeholders to sensitize people on the effects of child marriage. And this has been also included in the various in the advisory that we did for the president. Thank you very much.
Merci beaucoup.
Thank you very much. Now, can I ask the other member of the delegation to respond?
This is
Yes,
Chair, this is Abdi from the National Council for Children's
Chair.
Services.
This
is
I wish to
responding on behalf of Ministry of Health. The current position for Ministry of Health is that FGM is not legally medicalized, and as such not a government position to have FGM medicalized or undertaken in any health facility. So that's the government position as Ministry of Health currently. Thank you.
Noor?
Merci beaucoup.
You. Yes, please.
Le suivant peut continuer.
I wanted also to add to the issue regarding children and COVID-19. Just as Director has said, the advisory of our PS, Ministry of Labor and Social Protection, also had issues of coordination of children, especially as they leave the institution and go for family-based care forms. It also had directions on monitoring and of the children, both in the institutions and those ones at home. Linking of services, also children to be linked to services to available community from both the national government, county government, and even other service providers. There were also COVID-19 visits, which were mostly focused to child-friendly formats that have been provided in an effort also in this response. And along with this also, we had been very critical on issues of data and knowing children up to the grassroots and where they are and how many have been released and how many are. Was the first one that the CSC that I had to respond to, which was agencies in the children's sector, especially from the government, happen on the National Service, the National Council for Children, the Child Welfare.
Abdinur, your voice is Abdinur.
The National Council for Children's Service provide an overall regulatory oversight, advisory, and the coordination functions in the children's sector. And the council has received its categorization from the State Corporations Advisory Committee in March this year, and it's now fully pledged government state cooperation with those functions. As for the child welfare,
apparemment on n'entend pas Abdinur, si peut-être en attendant que le problème technique soit réglé, si on pouvait passer au suivant et peut-être retourner par après à Abdinur.
Welfare, rescue, and children who are placed in institutions.
Le micro d'Abdinur n'est pas activé. OK.
Coordination, one was on coordination. The director asked about COVID-19 response and children. So in terms of coordination, the advisory that the PS had given directly clarified on coordination of children. At the same time, also monitoring as children leave the institutions and those who remain in the institutions. Linking of services also to those children in the institutions and within the community. There were also COVID-19 messages which were more focused to children that we had provided also. And the other issue also was to get up that our children who have been released to the families and those institutions, and the supervision also been offered by the Department of Children's Services and other agencies dealing. Then there was the issue of synergy of government agencies working in the children's sector, with a particular concern to the National Council for Children's Services and the Child Welfare Society of Kenya. Honorable Commissioners, and the meeting, I wish to inform you that the National Council for Children's Services provides the overall regulatory oversight, advisory, and coordination functions in the children's sector. And now, since March, 4th March this year, the Council has been authorized by the State Corporations Advisory Committee for those functions, as we have noted. The Child Welfare Society of Kenya, order 5023 of 5 of 2014, also carries out and is mandated to carry out adoptions, emergency response, welfare, rescue, tracing, and reunification of children who are placed in the institutions. Thank you very much.
Thank you, Abdinur. Thank you, Abdinur. Chairman, have three answers, three questions to be responded, and I will ask Laura to come back again and answer the question on access to health by children and numbers, communication of COVID messages during the pandemic, and also management of other diseases, and also reporting or disaggregated reporting on data or for children on corona. Then I'll bring in also the Attorney General to tell us about victim protection, implementation of witness protection, and who provides oversight. Then lastly, I'll bring in the IPOA to tell us on to brief on the relating to more so on just in case, or rather the implementation or enforcement of the laws by the police. So kindly, quickly, Laura, please respond to those three questions, and then the IPOA and the AG office. Then we close the first round of questions.
Thank you, Chair. So I'm answering on behalf of the Ministry of Health.
Merci beaucoup.
Kenya delegation. With regards to COVID-19 messaging, the Division of Neonatal and Child Health, which is a division in MOH, was part of the Health Promotion Task Force Committee that was developing and disseminating child-friendly messaging on the COVID-19 pandemic. The Child Health Division was also engaged in media health talks to capacity build parents and caregivers on how for their children and how to talk to their children about COVID-19. This included messaging targeting special needs children and their caregivers. During the COVID-19 pandemic preparation, the Division of Child Health also gave guidance on how children were to be handled during quarantine process, as well as how mass testing of children was to be conducted. One recommendation that was given was that children were to be quarantined at home and not at a facility. However, if that was not possible and a child had to be quarantined in a facility, this was to be done together with a parent or a caregiver with the child in a separate area away from the adults under close supervision and with access to nutrition, water, and safe play spaces for the children. This was with regards to quarantining of children during this COVID-19 pandemic. We looked at the mental health of the children, and we noted increasing levels of anxiety and stress. The children continued staying at home. So we collaborated with the Mental Health Division and developed guidance on provision of psychosocial support of children during this pandemic. This guidance was disseminated to the county health management teams, and they were supported to further disseminate to facilities and communities. A referral system was created for any child identified with mental health issues where they were to receive appropriate care and follow-up. Accessing neonatal and pediatric routine health services, worked together with the following health divisions to ensure continuity of child health services across the board. The divisions we collaborated together were divisions of vaccine and immunization, division of nutrition and dietetics, the reproductive and maternal health division, community health division. We developed guidelines, job aids, and SOPs on COVID-19, targeting healthcare workers, and how routine health service delivery was to be conducted in all health facilities, mitigating any risk of transmission to any child visiting the health facility. We also mobilized community health workers who are trained on COVID-19, contact tracing, and supporting households to access health services. In with this, we strengthened our integrated community case management of all children under 5, where any household that had a child who was 5 years old and under was to be linked to a community healthcare worker, and this community healthcare worker would be visiting the household to ensure that in the household, hygiene practices were taught to the caregivers and the parents. For special needs children, special consideration in the guidance issued surrounding their management of COVID-19 disease in form of a special guidance to healthcare workers, community health volunteers, and caregivers. Our facilities were prepared to manage special needs children when they were referred for care there, and also on how to get to their caregivers on how best to care for them. The data for COVID-19, as at 15th August 2015, we had 768 children who were positively identified with COVID-19 disease. This data was granulated as per county level and also as per how many required ICU care. Of the 768 cases of children who were positively identified with COVID-19 infection, we had a total of 4 deaths up to 15th August 2020. Thank you very much, Chair. I hand it back to you.
1 minute. Chairman.
Merci beaucoup.
Chair, can I finish? There are 2 more people to present. I want to ask IPOA, and I also ask IPOA to say something, the Attorney General, and then the Munyerere to say something on the assistive devices of education. Please, let's take 2 minutes, and we finish.
Thank you, Chair. Thank you, Chair. Thank you, Chair. This is Stephen Mosao Waipoa. I want just to speak about the cases relating to prevention of torture in the country. One, with an ongoing process between the National Commission on Human Rights and IPOA, and also the Office of the Director of Public Prosecution, knowing that the mandate of investigating torture has been placed on the Kenya National Commission on Human Rights, but we have moved in to develop a memorandum of understanding in terms of how to ensure that that act is implemented in matters relating to torture, and mostly so how it happens around law enforcement agencies. And that is work in progress, and we anticipate that by the end of this year we'll have that work having been done. There was a specific matter that was raised about Yasin Moyo. This matter was received by it was investigated, and as we report right now, the matter is before court. The hearing is supposed, in fact, to start by this month, that's September. So that was done, and it was purely objective and impartial in terms of how it was conducted. We also have the cases that we are be able to investigate relating to child abuse around police premises, knowing that the authority has a mandate to investigate cases of police misconduct. And since this information that is in 2012, I can only speak about 22 cases that really relate to matters of police misconduct around children. And those are, some of them are being.
Thank you. Now, finally, Chairman.
And others are still under.
Okay. So thank you. Can I finally ask to answer this question? Children's Bill, where it is, the status, when do we expect it to be enacted? And then the Victims Protection Act. Implementation, the Witness Protection Agency that is implementation by the panel.
Thank you very much, Chair. I'll start with the Child Justice Bill. It is true that there was the Child Justice was which address issues of age of criminal responsibility. And it provides that a person under the age of 12 years shall not be criminally responsible for any act or omission. This will follow with amendments to the penal code once the Parliament. I'll not talk about the Prevention of Torture Act because my colleague has talked about it. The issue of the children, how long is it going to take? The process is now complete. They're awaiting presentation to Cabinet for approval and to be taken to Parliament for enactment. However, this one shall depend on the parliamentary calendar. We are optimistic that it is going to be passed. I would like to state that once it is presented to Parliament, it will be published. Memorandums will be invited for any further views to be taken into consideration by Parliament. This is about operationalization. I want to say that the Victim Protection Board is in place. The board has been constituted. It is receiving funding for its activities. The board has come up with a general regulation regulations for the Act, which are in draft form. They are supposed to be taken to Parliament very soon, as well as the trust fund. The board has also developed a victims' rights charter. A CEO has been recruited to manage the secretariat. The secretariat is still in its infancy stage. It is expected to be delineated from the Office of the Attorney General in due course so that it is independent. The board has not been able to join in cases because it is not fully independent corporate body. The process is still ongoing. The board currently has conducted agencies on victims' rights, and the purpose is to make them aware existence of the Act. Then there was the issue of the agency who oversees this agency. There is the Witness Protection Complaints Committee, which has been set up. It receives complaints against employees of the agency, as well as decisions made by the director.
I think you have answered.
I think I've answered all of them.
Okay.
Thank you very much, Chairman.
Thank you. Now, there are two questions which have not been answered, and I would like to ask Sylvester Mulambe, the Minister of Education, Dr. Sylvester Mulambe, to answer this question: the percentage of those accessing online learning, the effects of online learning, a suspension of learning and efforts to reopen schools, and also answer the question on assistive devices for education for children with disability. Kindly answer that, Chair. Those will be our last responses.
Yeah, thank you very much, Chairman. As soon as the COVID pandemic came, sometimes in March this year, we had to close schools and quickly, to allow for continued learning, we embarked on virtual teaching. The virtual teaching programs kept on being intensified as time went by, being also taken up by schools, but of course centrally coordinated by our institution called Kenya Institute of Curriculum Development. The level of use of virtual learning by learners kept on changing. Of course, at the beginning, it was lower because many learners may not have known that this particular facility was there. But through mass media took place, and definitely more came into play to join into the virtual teaching. I have asked an officer from KICD to actually segregate the data and help us with the percentage. And the officer is still in the process of trying to work on that. Hopefully during this particular meeting, we could be able to give that particular figure. On effects of virtual teaching and learning, we want to say that this particular initiative did help us to allow for continued learning when learners were at home. Of course, to keep them busy and to make sure that they utilize the time that they have in a useful way, make sure that they are kept ready for whichever time the school will open, and to also ensure that they don't undergo what we call the progression, because if the mind is not kept on in the form of practicing, then the mind may be able to slow down. So that this particular activity helped us during this particular period to still cover the content that could have been covered when learners were in school. But now with this particular facility, they were able to move on with their teaching, with their learning as they were at home. This particular also helped many learners to be exposed to technology. Many learners, many parents, and we feel that is quite an advantage. And of course, to sum it all in that area, we are saying that this particular innovation on virtual teaching and learning did help us to make our learners to use their time in a more useful way. Efforts towards opening, as soon as this pandemic came, we quickly sat down and developed a COVID emergency response plan, which was supposed to guide us towards responding to this pandemic, and also guide us towards recovery as soon as we get back to school, and maybe after this pandemic. We also went on to develop a COVID response budget where we try to quantify resources needed for the various activities within the plan, just to help us in the process of resource mobilization early enough so that whichever time reopening of schools would come, then we'd be ready to actually take care of reopening. Around the same time, a task force was also appointed by the Cabinet Secretary to look into the reopening of schools and the guidelines. And of course, out of that task force, we did receive a checklist of things which are supposed to be done before the school reopens. Issues of classrooms required and things like that, which today we have circulated through to all our head teachers, to all our field officers, to sensitize them on what is needed when schools will open, so that they start even being innovative, because maybe we may not be able to get resources for everything that we need, but we have told them at this early opportunity to start looking for ways on how even to improvise, so that we are able to get ready anytime when schools will have to be open. We also did come up with the community-based learning program, mainly to also engage the learners in more in other spheres of life, mainly issues to do with life skills and related issues. Of course, there was a court injunction on this. I think we are still leaving it to the court. I think as soon as we are out of this, then we should be able to have this community-based learning programs going on. On suspension of learning, I think this was very much advised by the happenings, or rather by the happenings with regard to positivity rates, mortality rates, of course, predictions that we are getting from Ministry of Health. And we looked at it and we saw we would rather have it suspended, because we also don't want to endanger the lives of our learners and teachers, trying to allow them to get to school when the pandemic is still biting on us at a very high rate. On the use of assistances, this one, we have a program now. We are calling a School Quality Improvement Program, SEQIP, under the World Bank, which has now factored in some amount. I think I've just been told by the director in charge, 100 million, which is now going to look into this. But of course, we also have partners that work with us, whom we also work with to ensure that learners get the needed assistive devices. Thank you, Chair.
Thank you very much. So, Chair, I think that brings to an end our responses. And I want to just close by saying that the Ministry of Labor and Social Protection, where the children rights and children issues are domiciled, is working very hard to ensure that the rights and all the charters that we have signed the country are honored. We have recently been vigorous. We have done a survey, a census. We carried out census on all the street families, children who are living in the streets, and we have issued a report. We have also carried out the violence against children and issued a report. We have also been vigorous and active in ensuring that all our children officers in all the sub-counties and counties are all working in tandem with what we have agreed as a country to do. So I think that brings to an end, and we are just summarizing. We have just summarized the responses to your questions, and I think we can be ready for the next round of questions. Thank you very much, Chair.
Merci très sincèrement, Monsieur le ministre du Travail, de la Protection sociale et chef de délégation. Nous allons passer effectivement à la deuxième série de questions. Et comme je l'avais dit au départ, nous avons en premier lieu l'environnement familial et protection alternative. En deuxième lieu, c'est la santé et services de santé. Après, c'est l'éducation, loisirs, activités culturelles. Et en vous avez déjà compris qu'il y a certains aspects de ces quatre groupements qui ont été déjà touchés.
Protection measures.
Et
Mr. Chairman, can you hear me? Can you hear me? Can you hear me, Mr. Chairman? Mr. Chairman, I can hear you. I can hear you.
Yes, interpretation is available.
I can hear you.
Mr. Chair.
Yeah. As I was explaining, we're once again going to give the floor to Honorable Ave Gava, and after that, Honorable Grenaditi. If you have any follow-up questions to ask, you can ask these questions, and thereafter make
thank
your
you,
other
Mr.
comments.
Chair.
And
I
thereafter,
have,
we'll give the floor to the others.
Yeah. Okay, thank you, Mr. Chair. I have a follow-up question in the area of education. With commendable investments in the education sector, pre-primary to tertiary levels, and continued professionalization of the profession. But however, there seem to be some gaps still existing in the ratio of teacher to students, which a child put at the rate of 60 students to one teacher. This was indicated by a child himself or herself. Also, another child did say in your report that he or she walks 10 kilometers to school in a dangerous terrain. So what are the government efforts towards further improving access to education to ensure that it reaches to the lowest in the society, it goes to the grassroots of the society, and what are government plans towards providing security for children who need to go to school, especially in the arid and semi-arid regions of the country. And to that end, I would like to know how this links up with the community policing project. Has it served in any way to make it easier for children to access education, especially in the dangerous terrains? That's my question on education. And then secondly, my second question is that the report gives very little information on the state of refugee children and internally displaced children. So can you enlighten the committee on what measures the state has put in place to ensure their continued access to very critical rights like birth registration? Has birth registration been extended to children who are in the refugee and are internally displaced camp? Do they have access to education? What kind of education need they do? Is it the formal or formal sort of education? And also on health, how much access do they have to health? And lastly, how much they have to participate in decisions affecting them, so that affecting them are adopted using a human rights-based approach. And my third question now was to start with the commendable interventions in combating sexual exploitation. You have a lot of structures in place. Is there a monitoring and a feedback mechanism in this in this area because of the proximity of the society to children at the community level, civil society along, trying to stem this tide? And you have about six functional one-stop centers. More light on their functioning, on the level of specialization, on the level of professionalization. What is on ground in terms of specialized capacity, and what working tools do you have? And how much is the community a part of this initiative? And then lastly, concerning the one-stop centers, there are 6 of them in the country to serve 47 countries. Is this adequate? Do these 6 one-stop centers adequately serve the interests of children across 47 countries in Kenya? Thank you, Mr. Chair.
Thank you very much, Honorable Abe. Honorable Naniki, you have the floor, please.
Thank you, Honorable Chairperson. My next set of questions. Let me start off with a question on the health budget. I do realize that in your report you have elaborated on the budgeting process. However, I would like to find out how you have addressed issues of disparities between counties in the budgeting, in the allocation of funds. And then coming back to the healthcare system, at some point the healthcare system was experiencing some challenges. For example, between 2017 and 18, you even had some protracted conflicts with the workforce, may I say that? How did that impact on children? And when you have such situations, do you put actions to ensure that the children continue to enjoy to be assured of their right to survival and development through access to health services? I know you have addressed it in detail, but just a short one on that one. What have you done to ensure access to sanitation and safe drinking water, or just water, which are really a requirement in the current fight against COVID-19? I'm asking with particular reference to remote rural areas and the urban slums. What have you done about ensuring access to water? Coming to the issue of immunization, I beg your pardon if I may have missed it in your explanations. I would just find out how far have you gone with the Global Vaccination Plan 2011-2020 in providing free immunization? What is your target, and how have you fared in ensuring that you provide free immunization? The other question I would like to ask is regarding accessibility or making available antenatal care and skilled midwives in the countryside, in the rural areas. How far have you gone in rolling out antenatal care and skilled midwife? What were your targets, and how far are you from reaching them? I'm going to ask a question on, you have talked about let me just ask a question first about schooling for pregnant girls. What kind of support, particularly psychosocial support, do you provide to pregnant learners during the period that they remain at school until they go home for maternity? And I realize that upon readmission, they are often readmitted to the schools they were attending unless they indicate otherwise. And therefore, I want to find out from you, what kind of psychosocial support do you give them so that you protect them from any undue stigma or pressures from their peers? Still on education, I want to find out how have you been sustaining school feeding programs during lockdown, in view of the fact that some children really rely on the school feeding program for their daily meal. What did you do then to ensure that such children continue to access food? Then to the Ministry of Health, how have you sustained the supply of supplementary feeding of food for the under fives? There is mention in your report of a program of treating children found to be culpable of sexual offenses. And oh, sorry, Chair. I'm sorry. Thank you. I'm just asking my question on. Can you hear me? Can I go on, Chair? Hello?
Yes, we can
Chair?
hear you.
Can you hear me? I can hear you. Chair? Okay, thank you very much. I was asking a question on the issue of treating children found to be culpable of sexual offenses. How many children have been treated so far? They have been treated and regarded as children in need of care. And what does that treatment really entail? There's also an issue of, there's something called non-violent sexual activity of children, and that if they are found to be engaged in non-sexual activity, I want to find out, what is this non-violent sexual activity? Please define it for us, and who determines it, that the children have engaged in non-violent sexual activity. Finally, in your report, there is a mention of election-related violence against children, and that you have 4 cases that were filed. May I know how long ago these cases are? When are they going to be concluded? What was the ages of the 4 children? And do you believe that if they are continue to be pending, justice will be served on the children? And what have you done to provide support to the children who definitely underwent some trauma during the time the violence against children was meted to them? Mr. Chairperson, these are my questions. Thank you very much.
Thank you very much, Honorable Naniki. There's Honorable Abe. I don't know if there's any other member of the committee who would like to take the floor.
Thank you,
Honorable
Mr.
Maria.
Chairman. Yes. Thank you, Mr. Chairman, and thank you to the delegation of Kenya. The questions have really exposed more to what you are doing in terms of improving the status and welfare of children. I'd like, however, to talk maybe on one question regarding the COVID. And in this regard, I am happy that the Cabinet Secretary for Labor, Minister of Labor and Child Protection is actually the lead delegate. And in this regard, I would like to find out how families which have become vulnerable because of COVID, and rather, which are vulnerable even before COVID, have been affected, especially those maybe which are headed by children. I don't know if you have those circumstances, but what measures have been put in place to minimize their vulnerability? And also, how are they affected in terms of not being exploited now because they might be expected to look for work if they're from vulnerable families, or being excluded from childhoodness and the rights that are associated with it, because instead of being children, they have to be adults out there fending for their younger siblings or parents. The second question I'd like to ask, and this is the final one, is regarding the moratorium on international adoption, which the country or the cabinet approved on the 29th of January 2015. And what happened thereafter is that when the issue was taken to court, because it was purportedly done under Section 162 of the Children's Act, the judicature judged that the action to place a moratorium was in excess of the power vested in the government, illegal, and therefore unconstitutional. So, what has happened in terms of from the time that piece of legislation was enacted, and what is the position now on inter-country adoptions in light of that decision? I thank you, Mr. Chairman.
Thank you,
Honorable Maria.
I see
Ermin,
would you like to take the floor? No,
No,
Mr.
I didn't
Chairman,
ask
I
for
didn't
the
ask
floor,
for
Mr.
the floor.
Chairman.
I just saw that your
Saw your
mic was
microphone.
on.
Well,
Thank you.
I'll mute microphone.
Any
Somebody
other
would like
member
to
would
take
like
the
to
floor?
take the floor?
Among
Any
members
other
of the
member
committee?
from the committee like to take the floor?
Chair, can I come?
So, Honorable Benyam.
Thank you very much.
Honorable Benyam.
Thank you very much. I will just raise a couple of questions as a follow-up. One question as a follow-up and a couple of new questions. The first is thank you for the delegation for the clarification that has been provided to the questions that were posed so far. And we appreciate the input that they've been able to provide. In relation to statelessness of children in Kenya, there has been clarification about what has been happening in relation to the children of Nubian descent. Everybody, and we had the communication that was brought before the committee where a decision was made. There have been some developments, positive developments in terms of the Marco and so forth. And I think we have to congratulate the government of Kenya, particularly the president, for leading that development. But in the meantime, we're curious to know if there are going to be any positive developments, particularly political decisions of that nature that will recognize some minorities within the province of Kenya, within the jurisdiction Kenya, as Kenyan citizens with a view to reduce the statelessness number of children within Kenya? So that's one follow-up question I wanted to raise. Two other questions that I want to raise, which also ties with statelessness and refugee and asylum seeker children. There have been a number of developments, including in terms of legislation, in terms of some of the conversation that has been in Kenya about whether or not a specific camp should be closed or should be kept open, and so forth, so forth. There are some allegations that there is significantly a securitization of the refugee framework within Kenya. Can we get an information from the delegation whether or not children's rights issues are taken into account, and to what extent when these policy level, legislation level decisions pertaining to asylum seekers and refugees are made? That's one. The second one is, I think everyone knows that Kenya has been confronted with a number of challenges pertaining to violent extremism and terrorism related acts. Of course, we understand the challenge that poses, not just for Kenya, but for the large continent and a number of countries within the continent. And we realize that the government of Kenya has been providing a number of guidance and interventions to address the challenge, particularly the human rights challenge that terrorism poses, including in relation to children's right to life, survival, and development. Having said that, there is also an understanding that counter-terrorism measures need to be compliant with human rights standards, including the African Charter on the Rights and Welfare of the Child. So we would like to hear from the delegation how the counter-terrorism measures of the government, how some of those operations that have been conducted by the government within the jurisdiction of Kenya actually take into account its obligations under the African Charter on the Rights and Welfare of the Child, so as not to violate on the right to life, survival, and development of children through those operations. And secondly, what are the measures that are actually being undertaken to prevent terrorism and violent extremism measures within the jurisdiction of Kenya? For instance, what are some of the interventions in terms of education, in terms of trying to make sure that children from specific communities that are in extreme poverty do not fall in the hands of terrorist groups and so forth? So it's an issue that I'm quite keen, and I'm sure my colleagues within the committee are quite keen to listen from you. And if there are any follow-ups, I will come back at a later stage once having heard the responses. Thank you very much, Chair, and again, thank you to the delegation.
Thank you, Honorable Benyam. Bakrin, are you asking for the floor? Honorable Abu Bakrin, and a member from the committee who would like to take the floor?
Is there any other member of the committee that would like to take the floor?
So here is Mr. Head of
Distinguished Head of Delegation, Ministry of Labor, Social Protection.
Questions and requests for clarification.
These are some of the questions that have been raised that are seeking clarification by members of the committee for the second series of questions.
I do not know whether you will need time to prepare your answer or you would like to answer directly.
I don't know whether you would like to answer the questions or you want to consult before answering to the questions.
Yes, Mr.
Distinguished Head of Delegation, you want to consult before or you want to answer the questions immediately?
It seems that there's a connection problem. Yes. Yes. Yes, sir, please.
Well, it would seem there's a problem of...
can you hear us?
Connection. Honorable Minister, can you hear Honorable Minister?
Yeah, the head of delegation.
Distinguished
Can you
head of
hear us? Can
delegation,
you hear
Honorable
me?
Minister.
The chairman.
You hear?
No. Hello. Is if you, yes, if you could just, do you prefer to be allowed? Do you prefer allowed time in order to prepare answers?
Okay.
Or you would like to answer the questions?
We wanted to know.
Would you like to consult
whether you needed
minutes
consult before answering,
or would you like to?
or you can go straight away and answer to the questions and issues that were raised. Do you
Honorable
need
Chair, Honorable Chair,
before answering?
can I just
go ahead?
2 seconds, please? Can we for the interpreters, French to English interpreters, both of you are interpreting at time. That's why the Honorable Minister is not getting the message clearly. Please kindly coordinate between yourselves. We need only one interpreter to speak. We'll get 2 interpreters speaking at a time, French to English. Kindly coordinate between yourselves. Thank you.
Thank you. Can you hear me now? Can you hear English? Can you hear it now?
Yes.
Can you hear English?
Yes, yes, please, yes.
Can you English? So the question is whether you would prefer to have some time in order to prepare your answers and come back the 20 minutes, or you would like to answer the questions straight away. Yes. Excellency, can you hear us? Can you hear the chairman?
Yes. 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 Yes, Honorable Minister. What the chair is asking is, do you need a few minutes to consult on the questions and get back, or do you want to reply? Chair, you have heard what.
So you're granted 18 minutes for consultation. 18 minutes. Thank you very much. Thank you.
So you may use the same link that we have sent you for the breakout session. Thank you very much.
Could we check whether the Kenyan delegation is?
Oui, Monsieur le Président, ils sont en train de se reconnecter à notre plateforme.
Yes, Mr. Chairman, they're trying to connect to our platform.
Yes, Chair. I think the delegation is back. Let's try. Honorable Minister, are you on?
I do not know whether the head of delegation is ready.
Honorable Head of Delegation, can you please confirm if you're online so that Chair can proceed with the meeting? Dr. Joyce, Ms. Laura, can you please confirm if the delegation is ready to make the presentation, please?
Yes, we are back and our CEO, Mohammed, is in the room. He can lead us.
We can't hear you if you are speaking.
Hello, can you hear me?
Yes.
Yeah, she's been saying their CEO is in the room and he can lead them.
Thank you.
You're welcome.
Monsieur le Président, en fait, la délégation est prête pour répondre aux questions.
Honorable members of the delegation, I think the chair has given you the floor to speak if you're online.
So if the head of education is online, he may take the floor. So give the floor to the head of education. Is Honorable Ngugi, can she hear us? Thank you. Welcome once again. Thank you. Yeah, you can.
Recommend for adoption children from either Kenya going to other countries or from other countries coming to Kenya, or children within Kenya where relatives or friends are adopting children, so that we embrace family way of life as opposed to institutional management of children or bringing up of children. We encourage family way of life where children are placed with families where we have adopted a father and a mother, and they are brought up as normal children. Some even including giving them names, family names. They also have any other inheritance, even as they grow up. So they are protected and embraced. Number two, the other item, so I believe this committee will run this process, will now operationalize. And that moratorium now, I'll be appealing to Cabinet to lift that moratorium. Since we now have structures in place, the committee will be able to advise. The whole intention, the intention of coming up with the moratorium was also good, because we saw smuggling of children, even children who had families, where people misrepresented information, We had also been hit by terrorists a lot around that time, and children were coming to Kenya for adoption, and they ended up turning up as terrorists. So as a security measure, the country had to adopt a moratorium so that we protect our country. We don't take advantage of our positive over our kindness to bring in insecurity in our country. The second issue is the government interventions on child-aided families and vulnerable families. Honorable Chair and all the panel of experts, Kenya has the most robust social assistance fund. We invest, or government contribute over 30 billion Kenya shillings to support vulnerable families, which is domiciled in my ministry. Through the Department of Social Protection, we are supporting 700,000 elderly citizens over 70 years. We are supporting 400,000 children under this program, and who are children or children-headed families. And we are also supporting over 47,000 people living with severe disability. All these funds are geared towards safeguarding or mitigating the pain of children and children-headed families. We have also a presidential bursary fund, over 400 million shillings per year is invested on children from poor families or children-headed families. So we support children from primary, tertiary, up to university. The third engine is we have also Street Families Rehabilitation Fund. This fund has about 200 million Kenya shillings every year. And out of this, we through the support of the World Bank, we were able to carry out, for the first time in history of Kenya, a census of all the street families and children, and even identified the reasons that pushes children to the streets. And we found the number to be 47 million Kenya. We are now looking or finding ways of supporting them directly, because we have now established the number. And finally, there was, during this COVID, a presidential program to support the vulnerable members of our society. And the president did, through our advice as a ministry, came up with a budget of 10 billion Kenya shillings to be administered through my Ministry of Labor and Social Protection. This fund, we are sending 1,000 Kenya shillings or $10 every Wednesday to 690,000 households which are headed by children and also senior citizens who are vulnerable or unable to support themselves. Most of the effects of Corona, as we've seen so many working members of our society lose job. Their normal airlines were closed or were parked, and flower farms, horticultural farms have been closed. Hotels have been closed. Many farms have now have become vulnerable. As a way of managing this challenge, government came up with this fund, and we have been sending through M-Pesa, which is a mobile money transfer, to 690,000 families across the country. And finally, we also have arid and semi-arid semi-autonomous government agency. We call it ASAL, who also receive money and spend this money in the rural and arid areas of our country. That is also another intervention that government has been running. Other than various bursaries that we continue to support before COVID, during COVID, there's been the schools were closed, but after, we will continue supporting families through bursaries for those school-going children. Now, the last one is programs or goodwill the government has for marginalized communities. I think it's almost similar to the second answer, but I can quickly say we have equalization fund, which targets the remotest part of our country. That is arid and semi-arid part of our country. We have 21 counties in Kenya who are dry or arid or semi-arid. This money is 8% of our national development budget, which is meant to support schools, health facilities, and other community projects. They are dispersed through either mainstream ministries, which are 22 in number, or our 47 county governments. The other intervention we are making as government on marginalized communities is we have a revenue sharing formula, which after National Assembly approves the budget, is then sent to the Senate, who oversee our 47 counties. It is then the Senate then sits down and agree on a formula. One of the considerations that is used in determining the amount going to each county is the level of poverty in that county, the remoteness of that county, the population of that county, and the level of infrastructural development. These are part of the consideration or factor or inputs in our formula. So having said that, Chair, can I also, in the same way as we did the other one, I've summarized your questions in this second round there are almost 20 questions. There are health issues, and I think I will ask Laura to be on standby. The questions are budget disparities in counties, how this is being addressed. I also want Laura to address the strikes in the health sector and how it affects service delivery for our children. Then the third one is immunization, the free immunization status. And the fourth one is access to antenatal care and skilled work. How it was rolled out, what was the target, and what is the current status. I also want Laura to address supplementary feeding program under the children under 5 years. And number 6 is access to sanitation and safe drinking water during this COVID in the informal settings, remote areas, and finally, refugee children, access to health, education, and other basic needs. So those are questions and issues relating to health. Now, relating to education, I'm asking Dr. Sylvester to answer the following questions: psychosocial support for pregnant girls before and after delivery, and even resumption of studies in school, so that we reduce the pressure of their peers. Access to food to children who are feeding from school feeding program. The student-teacher ratio, our measures to address 1 to 60. Distance to education facilities in remote areas, we are managing that. Security for children in remote areas. We have had their children who walk 10 kilometers in various safe areas. Number 6 is access to education for refugee children and type of education, formal or informal. Those are issues relating to education. Now, issues relating to children services, and I want to ask Director Noah Sangani to answer the following questions. Participation of refugee and IDP children, decision-making on matters affecting them. I will also ask, I wish Sangani to answer the child protection centers. Are they adequate for the 47 counties? And Mr. Masese from the AG's office to answer the statelessness of stateless children. What is our government position? Handling children found to have abused each other sexually. I will also he needs to define non-violent sexual engagement. That means, and then we have IPOA to give us to answer the question on post-election violence on children victims, ages, status of their cases in court. Then police to give us securitization of refugee matters. rights or refugee children? How are they being handled? Counter-terrorism measures, are human rights standards taken into account? I think those are the issues. And finally, police service is cushioning poor communities from being recruited into terrorism. So colleagues, my team, kindly respond quickly. Their questions have already been categorized, and I would give you 2 minutes each to answer those questions. Please, let's start with the health.
Thank you, Your Excellency. I'm going to start with health. The first question was on the health budget. Ministry of Health has a national and county budgets. The national health budget that caters to the needs of the children is based on priorities as drawn up by different divisions that manage different areas of health for children and neonates. When it comes to the county, counties receive their money based on a AGPON formula. And once they receive their monies, once this is allocated to them, they then base their health budget according to priority that county. So a county would look at its needs, health, and other areas, and depending on that, they will allocate the resources to health. We work in close cooperation with county health management systems, where we sensitize them on the policy direction that we take at the national level, and this enables them to come up with their priorities, especially those targeting neonates and children. The second question was regards to the industrial action that was taken by healthcare workers and what the government is doing to mitigate that in future. What has happened is that the Ministry of Health restructured and created a Department of National Health System Strengthening. This was one of the pillars of the health system that should enable delivery of health services that are accessible and responsive to the needs of clients, both young and old. It enables a system that has holistic focus on a conducive environment for service delivery. What has happened is that under this pillar, they are currently drafting their Kenya Resource for Health Strategic Plan that will run through 2023, and this will address on what a ministry at national and county level should be doing when there's a threat of industrial action by healthcare workers. So the strategic plan hasn't been finalized. It's happening in close consultation together with national, counties, and also partners. The third question was to do with immunization, free immunization program and our coverage. Currently, the immunization is delivered free of charge in all the facilities in the country and also in some select faith-based institutions. This is under the Kenya Expanded Immunization Program. The immunization program covers all recommended childhood vaccines and also the human papilloma virus vaccine for adolescent girls. Accessibility to antenatal care services for pregnant women. What Kenya has done is that it came up with an insurance program called Linda Mama. Any woman can enroll to this insurance program where they have free access to antenatal, delivery, postnatal services at all public health facilities in the country. For other women who may so wish, they can also enroll in the National Hospital Insurance Fund. This has a fee to it, but it also ensures that the woman has access to antenatal, delivery, and postnatal health services in faith-based and private institutions in the country. Supplemental feeding program for children under 5. Ministry of Health provides supplemental feeds to all undernourished children aged 5 and below in public facilities and faith-based facilities. Ministry of Health also provides vitamin A supplementation twice a year to all children under 5 free of charge. This happens at facilities, but also as an outreach campaign in the community. access to water, sanitation, and hygiene facilities. We have an environmental health program at Ministry of Health that works in collaboration with partners and county governments to provide storage facilities for water for slum areas and also rural marginalized population. County governments, through their water boards, are also able to provide water free of charge to vulnerable populations, especially during this COVID pandemic, with partners supporting such programs. We haven't been able to reach the whole country with this program, but plans for scale up are underway. Finally, access to health services for children in refugee camps. All refugee camps in Kenya have the UNHCR delivering health services free of charge to all populations. As a Ministry of Health, we oversee the health services that are provided to neonates and children in these facilities to ensure that they're in line with what is recommended in our national guidelines. The county governments also work in close collaboration with the partners, UNHCR, UNICEF, and the IRC to ensure that any child and even adult who requires specialized care that is not available in the facility is referred to either the county referral hospital or brought to a much higher level facility. On this service is provided free of charge so that the child can get the care that they need. Thank you, sir.
Thank you, Laura. You didn't answer one question. What was the target and what is the current status of antenatal care and skilled midwives? Do you have the numbers? Laura?
Sorry, I was muted. Currently, we have a coverage of 58% of skilled birth attendants. In the Cabinet Secretary's performance contract for Ministry of Health, the Ministry of Health intends to increase that to 60% in the coming financial year.
Well answered, Laura, and thank you very much for that elaborate response. Now, Chair, I ask the Sylvester to take us through education questions.
Yeah, thank you very much, Chair. To success to our education, and of course in line with our Constitution and the Basic Education Act 2013, that speaks of education being free and compulsory. We have these programs running: free primary education, in which every child is given a capitation of 1,420 per year, and free day secondary education, where each child is given 22,244 Kenya shillings per year to go towards their tuition. These moves have made many children come to school to an extent that the teacher-student ratio is still as high as was raised in the question. However, already efforts are in place to ensure that this particular is lowered to a good level. One is that recruitment process is going on, particularly to take care of the 100% transition. Teacher internship program was approved by Parliament, and the first phase for it has already taken place. And of course, they're going to do another phase. And of course, the replacement of teachers who have died or have left, the service through whichever other reasons is normally ongoing, so that the shortage is not realized. So these efforts together, we believe, are going to help us reduce on teacher-student ratio. The issue of distance to school, which was observed to be quite long in certain parts of the country, we are saying that initiatives in place have allowed decisions to start schools and to construct schools to the lower level, to the community level. In the national government, CDF, which normally has the resources for infrastructure construction, led by the member of parliament, normally is able to mobilize communities and are able to identify where schools can be constructed. And of course, the resources being available in that particular fund, then schools can be constructed at points that are supposed to be nearer to the learners. In addition, county governments also have the ECDE mandate, and of course, through that particular channel, the resources that can be used to construct ECDE schools or ECDE infrastructure can also be decided at that level. In addition, Chair, registration schools, which used to be done at headquarters by the minister, have now been devolved to county level. So it's county level, members of the communities are able to decide which school to register, all right? And that, of course, makes it easier for them. Still, on distance to schools, we have low-cost boarding schools program, where under the Ministry of Education, we have boarding schools, which are low-cost per se, where the cost of boarding is very low. And of course, together with what government contributes towards tuition, then it's easier children who may be coming from far to board in these schools and therefore avoid the long distances. About security for children, particularly in ASAL areas, what we have done from our end is the establishment of the low-cost boarding schools to avoid the movements of learners from together. But I think I may be assisted by my colleague from the police on security of these children who are out of school within the communities. About refugee children, the refugee children in Kenya do access the education that the other children access. They access the curriculum that all the other schools in the country access. We also have assisted to introduce them to our system of instructional materials acquisition, which is cheaper, making it easier for them to access textbooks and other learning materials, just the same way as public schools will also access. Also do the normal national examinations organized by Kenya National Examination Council, which means that they do exams, just the exam that just like the other Kenyan children. We do also help as a ministry to help train, capacity build their teachers whenever need be. Like of late, we've been having the competency-based curriculum. We did take it upon ourselves to also train their teachers and capacity build their teachers on competency-based curriculum, such that they can also be working at the same level as the other teachers in public schools. But of course, just like my colleague in health reiterated, we have UNHCR actually taking care of management of education of our refugee children. Now, coming is also the refugee policy on inclusion. We are trying to craft a policy to allow inclusion of refugees to our national systems so that we can be able to run with them together, so that whichever resources we give the public schools, we should be able to give them also. But that is something that is still in the process. The policy is at draft level, but we are trying to work on the costed plan so that as we continue consulting, we are sure of what it costs. We also do quality assure the education that refugee learners receive. Of course, that is also normally to ensure that they are actually learning just at the same level or the same standards like the other learners in public schools. About the issue of pregnant girls at school and the issue of psychosocial support, we have continued to have strong guidance and counseling departments and programs in schools, and we have always insisted on there being a teacher and actually a department concerned guidance and counseling. And actually through this particular service at school level, these particular girls can be assisted both before and after. Regarding school feeding program, we are cognizant of the fact that there are children, particularly in ASAL areas, that are dependent on this school feeding program, even for a living, considering the poverty level and also in Islam. Yes. So what we have done is that, and it's also important to reiterate that when the pandemic came, we had already sent some good amount of food to schools, which had not been given to the children. And then the children were asked to go home because of the pandemic. Thereafter, following our program, we again supplied more food through our field education offices. And what we did in this regard was to now prepare carry home packs for these children. And this carry home packs program has been done, and children have been given this food for them to take home and see. Thank you, Chairman.
Correct. Thank you, Daktari, for that very elaborate response. And I think you've covered all the questions which were raised by the panel of experts. Can I ask the Director of Children's Services to take on the 3 questions that were raised regarding children's issues? Sangani, you have met.
Mr. Sangai, okay.
Yeah, thank you. One question was on that refugee children participate in the decisions which are made. It is true that they do. And for example, in Kakuma refugee camp, we have recently posted a children officer to be in charge of that area. And the officer is working together with other UN agencies led by UNHCR and the UNICEF, both in Kakuma and Dadaab. We also have children officer stationed at the refugee camp. We are trying to bring all these children together so that as we handle the issues of Kenya Children Assembly, they are also involved in them. And currently we have we are working very closely with the UNICEF and the UNHCR, together with the guidance of the ministry, to come up with a memorandum of understanding on how we can look at the needs and welfare of the refugee children, both in Kakuma and Dadaab. On the issue of child protection centers, it is true that there are 6, and they are not enough, serving all the 47 counties. But we have also learned our lessons from the implementation of what is happening in the 6 child protection centers. For example, following the successful implementation in Malindi child protection centers, we are now trying to look afresh at that concept. And together with the assistance of UNICEF, we are now trying to look at how we can turn the child protection centers to be a model sub-county children officers in the country through the one-stop services of all the practitioners in the children's sector. That is what is happening already in Malindi. And then there was an issue also whether the child protection centers, the community is involved. It is true that the community is involved. For example, in Malindi, the communities around are involved in terms of, through our sensitization, we have brought them on board to be one of our key partners in the implementation of all the rights of children in those areas. Thank you very much, Chair.
This question. Thank you very much, Noah. You've answered very well. Can I ask the officer from IPOA, Independent Police Oversight Authority, to take us through the questions relating to post-election violence, ages of children, ages of the 4 children, status of their cases in court.
Thank you, sir. IPOA, we received the 4 cases in relation to children who are affected by the election violence. And due to this COVID situation, as per the response that was given, we only have one of the files that went again to the ODPP. We had reported that there were 2, but now we have 2. We have only one, which is under the authorities' legal view. The others, one matter is still in the court as per the court procedures. We also have now 2 files under ODPP and the 1 file which is still pending under the legal review. We are still fast-tracking those files, most of the ones which are with the ODPP, so that the matters can be presented before court. I also know that the police also did receive some of the cases relating to the post-election matters touching on the children, and I also welcome our colleague Rosman to say something about that. Thank you, Chair.
So, thank you very much, Musau. Mr. Masese, I want you to address the stateless children. What is our government position? Handling of children found to have abused each other sexually, define and sexual engagement. From the Attorney General's office, kindly respond.
Thank you, Chairman. I would like to say that at the moment, we don't have any information about stateless children in Kenya. The Constitution is in place and protects all the children who are in Kenya, all the children who are found in Kenya. We have Article 12, which speaks about entitlement of citizens. We have Article 13, which speaks about retention of acquisition of citizenship. Article 14 that talks about citizenship by, and especially Article 14.4. Article 14.4 talks about any child who is found in Kenya or who appears to be less than 8 years of age and whose nationality and parents are not known is presumed to be a citizen by birth. We also have Births and Deaths Registration Act, which talks about compulsory registration of all children born in Kenya, which includes those ones who are found in Kenya less than 8 years, whose nationality is not known, and even the parents are not known. The state does not discriminate any person or child who is found in Kenya. So at the moment, we cannot speak about stateless children in Kenya. Now, on the issue of non-violent sexual abuse, these are actually offenses against morality. They are under the Sexual Offences Act. These are offenses that do not include physical harm to children, but outrage the modesty of those children. It includes indecent acts that presuppose contacts with the organs of children, exposure or display of pornographic materials, etc., against their will. Most of these offenses are committed against vulnerable people, which include children. Any person who commits such kind of indecent acts against children is liable for conviction for a term of not less than 10 years. At the moment, I want to state that our office is engaged in the review of the Sexual Offences Policy and the Sexual Offences Act, so that we can be able to include all those emerging areas regarding offenses in the country. These offenses include promotion of sexual offenses with children, like distribution of articles that are intended to promote sexual offenses with the children. So I can say that the law, as it is at the moment, the country has law that provides for issues of statelessness of children, but which at the moment we don't have cases which have been reported. And as I said, the issue of sexual offenses, we are looking forward to amending the act so that we can be able to incorporate all those sexual offenses that have emerged, which were never foreseen by the drafters. Thank you very much.
Yeah. Then there was a question. Thank you, Masese, for that elaborate response. The National Police Service, there are two questions relating to your docket, that is securitization of refugee matters and the rights of refugee children, how they are being handled, counter-terrorism, and security of school-going children, especially in rural areas, and then counter-terrorism. Kindly respond to those questions.
Thank you, sir. I'll respond to the questions regarding the police officers, and on the security of children when they are out of school. We have Nyumba Kumi clusters and community policing committees who are at sub-location, location, ward, and county levels, and they work hand in hand with police officers to ensure safety and security of the children. Nyumba Kumi is the lowest level of community policing, where we have 10 households forming a cluster. And we have these elders who work closely with the police officers to handle security issues. And they're very, very effective. Then to avoid children being radicalized and being recruited in violent extremism, there are measures that were put in place through the formation of the Nyumba Kumi clusters and through establishment of anti-crime clubs and community policing clubs in schools, where we are able to teach the children on various crimes and on how to observe the laws and everything that deals with the security. Then we have establishment of toll-free police hotlines, where the members of public can call anytime to inform us whenever there is radicalization taking place in a certain area. We have also community sensitization programs against radicalization that we run oftenly, and also we create awareness through community policing forums and meetings. In addition to the one-stop shop, we have a one-stop shop called Polycare in Police, and it deals with sexual and gender-based violence and children-related cases. In this center, we have police officers, we have doctors who examine the victims, we have the judge who presides over the case, we have counselors who provide psychosocial support, and children officers together with provision officers. This one enables the children victims to get to justice easily. Then on the issue of refugees, we accord them same rights just like the citizens of the country. Thank you very much.
Madam, what about security of school-going children in rural areas?
Regarding the security of the school-going children in the rural areas, we have police officers on the ground.
And also in the unsafe areas. There is an observation that there are children traveling or moving up to 10 kilometers and through unsafe areas.
For example, where we have incapacitation, then we have these elders, the Nyumba Kumi clusters, the community policing committees. They are members of public who work hand in hand with us police officers. They are all over. They are even at the household level. at the sub-location level and the location level, and they work hand in hand with police officers, and we are able to provide security to the children with them.
Thank you, Rosemary. Thank you for that very good response, and thank you for the service you're giving as a service, as a police service to the citizens of Kenya. Now, I have the final question is on registrar of births and deaths and issuance of birth certificates to refugee children. I want to ask Esther Kadogo to respond.
Thank you very much, Chair. Good evening. Yeah, it is in response on registration of birth issuance with respect to the refugees or the refugee camps. According to the Birth and Death Registration Act, Cap 49, it is the mandate of civil registration services to register all births occurring in Kenya, irrespective of nationality, and of all Kenyans occurring abroad. In this case, therefore, the refugees are registered, and this is done through the assistance of the UNHCR, where we have two folds of registration, where they are born in the hospitals, and this is facilitated by the UNHCR in collaboration with our office, the Civil Registration Office. So once they are registered, they are accorded the birth certificate, and those are the children who are born in the hospital. In the event the children are not born in the hospital and maybe they are born outside the hospitals, which are in the camps, we refer to it as late registration. And again, using the assistance of the UNHCR, in this case, will profile the cases that will profile each individual case of the child who is not registered. This is by working hand in hand with the Refugee Secretariat. We do give the details of the parents of the child and even other particulars in regarding to the child, and in corroborate to our office, where they fill in the forms and they forward the respective details to our office, and we facilitate the registration of the child. Upon registration, the child is accorded the birth certificate. So in this case, we don't expect to have any issue with birth certificates because it is well facilitated as we work together in corroborate with the UNHCR and our office. To you, Chair. Thank you very much.
Wow, thank you very much. Thank you very much, Chair. I think that again summarizes the second round of questions as far as today's theme is concerned on I think this will be on the Kenya second and third state party periodic report on the rights and welfare of the child. So I think my team has been very they have been spot on and they have answered all the questions well. I think to the best of our knowledge, that represents the position of our country. Thank you. You have muted, Chairman. Chairman, you have muted.
Sorry. Nous vous remercions, Monsieur le Président, Monsieur le chef de délégation et en même temps ministre.
The Minister of Labour for Labour and Social Affairs for the answers that provided, and would like to thank also your delegation. I'd like to continue these discussions, but as you see, there are time constraints and we've gone even beyond that was allocated to us, and there are also some technical problems. So I would like to ask the indulgence of the members of the committee that so we can conclude this debate, and of course there will remain follow-up questions, and
Excellency Minister, you could, of course, send some clarifications in writing to our Secretariat. Some pending questions that need probably more clarification. But before we have seen that there are 2 children in your delegation, Richard, Michael, and Yoma Malinga. I don't know whether those 2 children are on. Could we hear the voice, Michael? We would like, it seems that Michael is online. Do you have a message to pass on to the committee, Richard Michael? Can you hear English? Can you hear English now?
Translated in English because I'm not perfect in that language, kindly, sir.
Yeah, now it's okay. Mr. Chair, can
Non, je disais que si une fois il aurait un petit message à adresser au comité. Michael, can you hear me?
Yes, sir, I can hear you.
Yeah?
But I was requesting that I would wish for a translation in English because I don't understand that language very well.
Michael, he has asked you whether you have any comment to the panel.
Yeah, I think I do.
Statement.
Yeah, I do.
It's a general statement he's asking. As far as my French, you know, the nearest French country to my country is about 800 kilometers. So that is the level of the. I can get it, but I cannot speak it.
Okay, I've got a concern to the panel anyway. Am I allowed to proceed?
Yes, I think the chair has given you time to speak.
Okay, what I would like to say to the panelists is that I'm very grateful of my government for the great concern they have for the children. Most of the requests we made to the government, it has been put into practice and we can see them. And also as children representative, I would like to say that the children within the nation, Kenya, are very happy with the government and we are very glad. Actually, most of our problems have been presented and they are put into work. And also this issue that was affecting children mostly was about the new education method, whereby we use the visual education method. Most of the children from the remote areas could not get access to it due to lack of power and some connection and lack of well equipment of the new devices or the KICD materials for learning. But up to this moment, I can say that government have enhanced and the materials are within. So there are only just little improvement the government is working on, and the children very soon, I believe and I hope they will get to start in the remote places. Otherwise, thank you so much and that's all.
Merci beaucoup, Michael. C'était une joie d'être également
It was, we've been really delighted to hear from children and participation, one of the 4 principles of the Charter. And thank you very much for your message through hearing the voice of child. On this, Excellency Minister, Head of the Delegation, I'd like to thank you very sincerely for this information that you provided with, and also for also submitting your 2nd and 3rd periodical report. And I must mention that countries have already sent their 2nd periodical report, like Burkina Faso and Rwanda. Otherwise, generally, normally after the issue of the report, the debate, we should have a group of family, but because of this COVID-19 pandemic, it will not be possible. Otherwise, the committee will deliberate later on and will send the final observations on the report that we have heard and the debate that we have had. And 2 years later, we will make a follow-up of your country in order to evaluate the progress. Otherwise, we would like to thank you again. I do not know whether you have a last message to us, Minister. Thank you.
Thank you, Chair. What I want to say is that it's my first time to attend such a session and meeting many distinguished members of experts panel. And as a country, and stated by my members of my delegation, we are committed as a country to ensure that we honor every bit of the Charter and even go beyond the Charter in terms as far as children and children issues are concerned. We have, in the recent past, domesticated many international charters, both international and African charters as far as children are concerned. And we are moving forward as a country and entrenching those positions in our laws. As a minister, on behalf of the government and the Republic of Kenya, we will continue and will endeavor as a country to move ahead in ensuring children are protected, children are safe, and children are supported so that they can live a normal life up to their a normal life as they live in this country. So many legislations like the Children's Act 2020, we have talked about it. We are going to fast track because that is a landmark bill that will really speak to all the issues relating to children. And we remain a signatory to many national laws, including children in transit, including people adoption and child welfare, child education, child abuse, violence against children are things that we as a country are totally committed. So on behalf of the people of Kenya, on behalf of the government of Kenya, we are working hard. Thank you for working, and we thank you for working with us. So I want to, on behalf of my delegation, I want to thank you and all the best. God bless you.
Merci beaucoup, Monsieur le.
Thank you very much, Mr. Minan, Head of Delegation, and I would like to thank our colleagues, the rapporteur, Honorable Aver and Nkiwe, and I thank interpreters, thank the participants, and I think that we are determined to help and assist the government of Kenya to move on, and hope that now by 3 years from now you will be able to submit your periodical report. Otherwise, we'll come to the end of this third day, and we would like to suggest that that the next item on the agenda will be examined on Friday. As for other participants, there are only 2 closed sessions left, and we will meet you during closing ceremony next Tuesday. So there will be only, we'll meet with the members of the committee and interpreters tomorrow. Thank you. Thank you very much. Thank you, Mr. Chairman. Thank you.
Thank you.
Bye-bye.
Thank you.